Sex has been an openly discussed topic in our society for decades, but in recent years, safe sex has not been as pressed as some feel it should be. However, fortunately, the teen pregnancy rates seem to be dropping. I believe that these drops have been caused due to the more open discussion of birth control and advertisement, along with accessibility. According to the Center of Disease Control, only about 50% of teen mothers in 2011 earned a high school diploma before the age of 22, as opposed to the around 90% who had not given birth during their adolescent years. Another astonishing statistic is that about 1 in 4 teens contracts either a sexually transmitted disease or a sexually transmitted infection during their adolescent years. The American Sexual Health Association publishes sexually transmitted disease and sexually transmitted infection statistics in conjunction with the Center for Disease Control annually. There are estimates published stating that there are 19.7 million new sexually transmitted infections every year in the United States. And on top of that, sexually transmitted infections are costly. The direct cost nears close to $15.6 billion US dollars annually. But yet fewer than 1/3 of U.S. physicians routinely screen their patients for these infections, unless the patient previously requests to be screened. And when those patients are diagnosed positive with an infection, only 5 are required to be reported to health departments and the CDC. Those 5 reportable infections include gonorrhea, syphilis, chlamydia, hepatitis A, and hepatitis B, which is 100 times more infectious than the human immunodeficiency virus, or HIV. Reducing your risk of exposure and infection is crucial for your well-being and your health. Choosing to be sexual with another person exposes more risks than the obvious. Individuals must make their own decisions to weigh the risks and rewards of having unprotected sex. Set boundaries and decide what barriers you want to use or what risks you are willing to expose yourself to. Stick to morals and plans so you don't face an unwanted pregnancy or a sexually transmitted disease or infection. Protecting yourself is also important to our society because you can potentially help to improve your world around you. Social issues such as poverty, child abuse and neglect, parental absence, school failure, and poor preparation for societal integration are among topics that run wild within the teen sexual pregnancy community. This topic runs far deeper than what most of us generally know about it. To change our world and to make it better, we must first start with ourselves. For more information and for further research on these topics, check out www.ashasexualhealth.org, www.cdc.gov/teenpregnancy/preventteenpreg.htm, and thenationalcampaign.org.